Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
I am pleased to welcome Dr. Jose Colon, who is an active practitioner board certified in sleep medicine and neurology with the special qualifications in child neurology. Child neurology, that's pretty interesting. So how did you first get into the field of healthcare and that specifically?
Originally going into medical school, I wanted to be a general pediatrician. And while I was going through my rotations and I did my pediatrics rotation at the time, I found it very difficult to give parenting advice when I wasn't a parent myself. So I started to take other courses, and I took neurology in my fourth year of medical school, and I just absolutely fell in love with it. And then I learned that if I were to do child neurology, I could do both neurology residency as well as some pediatrics, and that just seemed like the perfect fit. I did my neurology residency, child neurology fellowship at Vanderbilt. And at Vanderbilt University, the Department of Sleep Medicine was through the Department of Neurology. And I didn't go there to be a sleep disorder specialist, but I got exposed to it, and I just absolutely loved it and haven't looked back ever since.
So how have your interests and your outlook evolved throughout your career?
I started out with opening up a child neurology practice, and I also was seeing sleep medicine. And the sleep medicine grew to the point where they needed someone to do that full time. So these days I do sleep medicine full time, both in adults and pediatrics. But in one of the questions of how did it evolve, really early on I started doing the standard of care. I learned that if you have a certain disorder, that there's a certain treatment that you give, and that it's studied, and you go with the standards. So I found myself prescribing medications to a subset of population, whether it was for ADHD or whether it was for sleep or migraines, and this there was a subset of the population that wasn't improving. I did have a mentor that encouraged me to go through the American Society of Clinical Hypnosis. And I went through it, and it was life-changing. Actually, I learned hypnosis to help my patients, but I really helped myself as well. And in the journey of learning more, I learned more about mindfulness-based stress reduction and started incorporating that into my practice. And then something happened along the lines of evolution, as you mentioned. There was this day that I was going to my happy place, which was Barnes & Noble. I am also a writer, and writers like to read. You can't be a writer if you're not a reader. And I was going to my happy place, and out of the corner of my eye, I saw a brain. And when a neurologist sees a brain, your eyes just kind of gravitate towards it. And I took a look at this book with the brain on it, and it said, Grain Brain. And I was like, what's that? And then I looked at the author, Dr. Perlmutter, and I had some positive interactions with Dr. Perlmutter in the community where I'm at in Southwest Florida. So I reached out to him, and he's the one who influenced me to learn more about root cause analysis and to learn more about functional medicine. So it's been an interesting journey that continues to evolve today.
Very interesting. So from pediatrics to neurology to sleep hypnosis, and then now functional medicine. I do like that transition. Earlier today at the neurology module, you mentioned that you led a presentation on targeting sleep disorders. Will you share with us a brief overview of this presentation?
So this neurology module I am incredibly impressed with. The diversity of what they have, the comprehensiveness has been amazing. And many people are not taught, many physicians are not taught about sleep in medical school, as well as many other practices. But I'm incredibly impressed that A4M included sleep in there. And what I focused on was how sleep disorders can impact the brain. and how sleep is needed for neurologic homeostasis as well, for just maintaining your brain activity. And some of the points of emphasis that I was putting is what is normal sleep, and we talked about the sleep cycles, we talked about circadian patterns, and then we also talked about disorders such as obstructive sleep apnea, restless leg syndrome, REM behavior disorder, which can be an early sign of Parkinson's disease, and circadian disorders can be an early sign of Alzheimer's. And we were talking about the interactions of these. And it was a very good time, inquisitive group. The other thing that I discussed is that there's times that I see a patient, let's say for sleep apnea, and I fix their sleep apnea, and they come back to me and they say, "Doc, I'm still tired." And talked about the importance of doing root cause analysis, looking at micronutrient deficiencies, looking at mitochondrial function and trying to optimize those things. And the same thing, sometimes you do a treatment for insomnia and there's still some degree of sleepiness, and or there's still some degree of insomnia even though you did the treatment. And it's important to take a look at neurotransmitters, hormones, and micronutrient analysis as well.
And there are some various ways in which patients and practitioners attempt to tackle sleep conditions. Will you share on what kinds of methods and treatments are most often used in your practice?
So I use a root cause analysis. When people say sleep, that can mean many different things to me. Like if someone says rain, okay, there's light precipitations, there's thunderstorms, there's hurricanes, there's dew, and likewise with sleep, you have to start with getting the right diagnosis. And sometimes you need a sleep study, sometimes there's ancillary studies that can help. So you start with that particular diagnosis and treat that. There are some times that studies may come back negative, and we have a insomnia or difficulty getting to sleep or staying asleep. One of my favorite ways to address that is with mindfulness-based stress reduction. We all practice up-to-date evidence-based medicine, and even then, people emphasize sleep hygiene a lot. Going to bed at the same time, using your bed for sleep only, avoiding substances, and sleep hygiene is important, but the best available evidence that's out there shows that a regular practice of mindfulness-based stress reduction is actually more powerful and more effective than sleep hygiene alone.
Wow.
Yeah.
Could you get into a little bit more about the mindfulness practices that people can use to enhance their sleep?
Yeah, so mindfulness, enhancing sleep with mindfulness, there's two things, okay? Number one is what I call heart rate, brain rate. Number two is what I call non-judgment. So in number one, talking about heart rate, brain rate, just like everyone has a rhythm to their heart, we also have rhythms to our brain as well. And you measure this with EKGs in your heart and EEGs with the brain and sleep studies. If somebody is agitated, their heart rate goes up, and what does their brain do? It goes up as well. They start thinking about things that haven't occurred. Well, if someone's in bed and they're agitated and they're not asleep, their heart rate's going to go up, their brain rate's going to go up. The harder that someone tries to sleep, the more it's going to evade them. In a regular practice of mindfulness, you're having a parasympathetic response. One technique that I use is like an awareness of breath. And when you do an awareness of breath, the respiratory rate naturally slows down. And when you're breathing slower, breathing in, your heart can be variable. As you exhale, you have a parasympathetic calming response. And when your heart calms down, your brain is able to calm down as well. So one way that mindfulness can be helpful for sleep is that you're improving the parasympathetic response and calming the brain. Now, a second way is, I mentioned non-judgment. And one of the things that happens a lot with patients with insomnia is that they can be, they're labeled as catastrophic thinkers. They have thoughts that are going to be bad about their sleep, and then they're going to have consequences the next day, and it can kind of spiral into staying up all night. And the practice of mindfulness is about paying attention to the present moment and not judging the current circumstance. So the practice of non-judgment also helps bring people away from some of these catastrophic thoughts.
Interesting. So we can actually overthink ourselves into insomnia.
It's actually the most common cause.
Wow.
Is something called psychophysiological insomnia. And what that is that some people have difficulty sleeping because something's bothering them. And what's bothering them is that they're not asleep. So the harder that someone tries to sleep, the more that it evades them. And commonly, I'll tell my patients, listen, the first thing that I need you to do is to not worry about sleep. And they look at me and I say, I know you're here because of sleep, but I need you to understand. And I talk about the concept of psychophysiological insomnia and let them know that the harder that we try to sleep, the less we're going to get. It's not a light switch. It's more, you can't flip a switch and get sleep. It's more a balance between the brake pedal and gasoline pedal, kind of a harmony there.
Got it. So as someone who is coming from South Florida, how are you personally dealing with the time change as we're here in San Diego?
So there's a couple ways to deal with it. And the way that I personally deal with it is that I do what I can to stay on my own time zone. So I put the blackout curtains early. I will go to bed around the time that I normally do, if I'm able to. And I wake up really early and one of the first people in the gym. Typically, it takes 1 day for every 1 hour time zone that you change to adjust. Symptoms of adjustment can be difficulty with sleeping in the evening and fatigue during the daytime, as well as some GI symptoms. So if it is a couple hours, I do what I can. And if it's a couple hours and I'm only going to be here for a couple days, I try to stay on my own time zone. Otherwise, other methods, if you do need to adjust, if you're traveling, if you're going to Europe, if you're going to be here for a week, methods is getting early light exposure when you arrive, taking some melatonin in the evening, and also getting some exercise. There is a certain degree of jet lag that people are going to have, and staying hydrated and just doing what you can to kind of overcome it, because the travel is worth it. What are you going to do? Not travel? That's not an option for me.
Right. And of course, we're definitely not going to overthink our sleep.
Correct.
So you've dedicated a significant amount of time to working to educate the public on sleep health. What role do you believe education plays in the work of a clinician?
Well, the Latin root of the word doctor is teacher. So the role that the doctor has in education is, that's the role, is teaching. It's not just diagnosing and treating, but you have to educate the patient. And I take in my community a very active role in community education as well. So I give a lot of different community talks about sleep health, and also I do a lot of community meditations as well.
Thank you, Dr. Colon, for being here and taking the time out to talk to us and, of course, educate us on sleep health. We hope to have you back on the podcast soon.
I'm humbled to be here, and thank you for the opportunity.